Sinus infection and nasal allergy can significantly impact a person's quality of life. We're checking in today with Dr. Shane Gailushas from Mercy's ENT Clinic, and he's here to help us understand how these allergies differ from other types and provide some valuable input. So thanks for joining us
Of
today,
course, I'm happy
Dr.
to be here.
Gailushas.
Thank you so much.
Tell us a little bit about what's happening here at Mercy in this area.
Yeah, absolutely. Well, one of the things I love is that I came to Mercy and they were so excited for us to build the Sinus and Nasal Center here at Mercy. The goal of this center is to focus on everything that the patient needs to be able to make their sinuses feel better, whether it's nasal breathing, whether it's improving allergy, whether it's dealing with recurrent sinus infections. And we take a very whole patient approach to this. We are really trying to solve sinus disease and allergy as much as we can.
And really understand the person and the individual need.
Exactly. And it's very individual. There's very small individual pieces to someone's situation that can really require different types of treatment. And it's important that we get that right.
Let's talk about the difference between nasal allergies and what we often think of with seasonal allergies. There is a difference there, correct?
Yeah. Basic allergies many people have in the spring and the fall, but sometimes people who experience this often or more frequently, or they're in areas where they have really strong sensitivities, it'll eventually spill over to become more of what we call a chronic sinusitis or chronic sinus issue. And this is where the nasal tissues, the sinus tissues become dysfunctional from the constant insult from the allergies. In that situation, people say, oh, my allergy treatments don't work. I used to take Flonase and it worked and it doesn't work. Or I'm taking Zyrtec and it's not helping anymore, so I have to switch to something else. What's really going on is it's kind of pushed it over this edge into a place where it's remaining constantly aggravated. Now, of course, Iowa, I love Iowa. It's beautiful. There's so many wonderful things to do. Everything grows here, but that also means that everything grows here. So I do see a lot more of this chronic sinus disease in Iowa, and people will often say to me, you know what? Yeah, just year over year, it's just gotten a little worse, and now I'm at this point where I'm having this all the time, and I don't know why.
People probably don't even know maybe that they're breathing differently when they have these nasal issues, but in fact they are.
Yeah, absolutely. So obviously, if you're having an allergy attack, or as we all know, you get a cold or whatever, your nose will get stuffed up. So isolated situations of nasal swelling will cause breathing issues. But some people will develop a more persistent nasal swelling issue that will affect their breathing. In addition, there's structures inside of our nose that are called turbinates. They're supposed to be there, but they will slowly get larger over time. And as they do that, they fill up the nose and people will struggle to breathe. Also, people might be in my situation, which is where they have nasal polyps that have developed. Now, nasal polyps are not like colon polyps. They don't turn into cancer. It's not the same thing. But what they do is they make your allergies a lot worse because they get easily triggered by allergies. And as they enlarge inside your nose, they block your sinuses, which causes more sinus infections. And they block your breathing, so you don't breathe quite as well. And it's so slow of a process, you don't even notice that your breathing's getting a lot worse.
And how can that affect someone on a daily basis?
Oh, very much so. Most particularly at night, because people will not sleep well if they don't breathe well through their nose. And then also if they're constantly dealing with pressure in the sinuses, if they're constantly dealing with days where they have, sinus infection, it can be very, very troublesome for people. A common version that we'll see with patients is that they just can't tell from day to day how they're going to feel. One week is great, next week it's terrible again, and they're back on an antibiotic. And we want to solve that.
I do think people think sometimes that they have to live with it.
Yes.
It's the way they are, and so they don't seek help.
Yes.
Do you find that often to be the case?
Oh, yes, absolutely. And I do find a lot of people too that after we take care of the problems or we do the treatment, like, oh my goodness, I didn't realize I wasn't breathing so well. That was me. I mean, when I was a patient dealing with this, that was me. I was like, oh my goodness, wait, this is how people are supposed to breathe?
Yeah,
I didn't realize. Wait
feeling
a minute.
so much better.
I'm not supposed to feel this all the time? Oh, is that how that works? So I think it's really important. And that's why we run the center, because we will take someone, hear their story, and try to break down the different pieces of it and approach each piece individually to bring the whole thing together for them so that they are breathing better, they're feeling less issues, they're having less days off work, they're having less issues with sinus infections.
So let's talk about some of the solutions. Once they get to you, what are some of the things that you're able to provide that may bring some relief?
First, we do just a comprehensive understanding of what's going on so we can isolate some of the problems. We'll definitely work on allergies. We'll treat those. We do a full examination to see where the nose is, what the shape of the nose is. Are there any polyps inside? Some things we can take care of in the office. So for some people, that turbinate hypertrophy I mentioned causes a lot of issues with sleep. These are people who will say to me, you know what? At night when I lay down, my nose closes off on one side, and I flip to the other side, and then it switches. That's turbinate hypertrophy. We can shrink those down in the office, very minimally invasive procedure, and it's highly effective for that problem. Taking care of nasal polyps, we can often do in the office. Balloon procedures we can do. And then sometimes people need something more comprehensive. They have extensive sinus disease. But the key is being able to see that patient, go through their history, go through their story, and tailor individual treatment plan for whatever it is they need to get them better.
And if people want more information, they can go to mercycare.org/ENT to kind of start the process and check out a few things on our website and continue from there.
Yeah, 100%. If you have those issues, just come by and see me at the Sinus and Nasal Clinic at Mercy.
Okay. Thanks for joining us today and helping us breathe easier.
That's
Dr.
what we want.
Gailushas.
Absolutely.
Thank you so
you.
much.